Hello, everyone. Welcome back to the channel, where we dive deep into the world of health research. Today, we're tackling a critical topic that is impacting every corner of the globe, the climate crisis. More importantly, we'll explore why this is an urgent call to action for health researchers. If you're a medical or health professional, researcher, or just someone interested in making a difference, this video is for you. Let's get into it. Climate change is no longer just a looming threat. It's here, and it's affecting every aspect of our lives. Rising temperatures, extreme weather events, and environmental degradation are creating new challenges for human health. The World Health Organization estimates that between 2030 and 2050, climate change will cause approximately 250,000 additional deaths per year due to malnutrition, malaria, diarrhea, and heat stress. But it doesn't stop there. Climate change is exacerbating chronic conditions like cardiovascular diseases and respiratory issues. Air pollution is now linked to millions of premature deaths annually, and vulnerable populations, such as children, the elderly, and low-income communities, are suffering the most. Now, why should health researchers be at the forefront of this issue? As health professionals, we are trained to address diseases and improve patient outcomes, but we also need to consider the bigger picture, the environment in which people live. Climate change is altering disease patterns, increasing the spread of infectious diseases, and overwhelming healthcare systems in vulnerable regions. More importantly, health research is essential to developing the interventions we need to mitigate and adapt to these changes. This is where you, as a health researcher, come in. Whether it's conducting research on climate-sensitive diseases like malaria or dengue, studying the health impacts of air pollution, or advocating for climate policies in healthcare, our role is vital. We can use research to inform policy, develop adaptive health systems, and advocate for the protection of our most vulnerable communities. First, we need more studies on the links between climate change and infectious diseases. As temperatures rise, diseases like malaria, cholera, and dengue are spreading to new regions. Second, the mental health impacts of climate change are increasingly concerning. Anxiety, depression, and eco-grief are real issues affecting millions, especially in disaster-prone areas. We need more research and mental health services to address this. Third, health researchers need to help design healthcare systems that can withstand climate shocks, whether that's by improving infrastructure, emergency preparedness, or supply chain resilience. And finally, it's critical to focus on health equity. Climate change disproportionately affects poor communities and countries with weak healthcare systems. Addressing the social determinants of health, ensuring access to care, and advocating for justice must be integral to our research. We are facing one of the most significant public health challenges of our time. But with every challenge comes an opportunity. As health researchers, we have the knowledge, the tools, and the platform to make a difference. It's time to harness our expertise and collaborate with environmental scientists, policymakers, and communities to drive real change. So, what can you do? Start by incorporating climate data into your health research. Investigate how climate variables like heat waves, floods, or air quality are affecting health in your area of study. Collaborate across disciplines, from environmental science to public policy, to push for climate resilience in healthcare systems. Remember, the climate crisis is not just an environmental issue, it's a health issue. And it's one that requires urgent attention from the health research community. Thank you so much for watching.